My name is Abby. I am 7. Why is it getting picture of me? Hello.
My name is Jen Keener.
My name is Joe Keener.
We have 3 children. Emma is 9, Abby is 7, and Ben is 5.
All right, at the time of birth, I remember I just had an inkling that there was something going to be unique about Abby. The next morning, they came in and told us that they had suspicions that she had Down syndrome.
It's not what you were expecting. So what do you do with that? She's still our child, and that doesn't change anything. So she has Down syndrome. Well, it's going to be a little bit of an adventure, but it doesn't change our love for her.
Later that day, one of the nurses came in, and she may have asked how long she had looked like that, and I didn't know what she was talking about. Well,
None of us really noticed. The nurse was concerned about her color,
had changed.
and she was turning dusky. Because her heart was not functioning, wasn't pumping properly, it was affecting her oxygen level. And that's when there was discussion that there may be a heart condition, which actually is very common with Down syndrome.
Her official diagnosis at that point was that she had an AV canal defect.
Probably one of the biggest things was she really lacked energy. Feeding, just having Down syndrome was very difficult because she has lower muscle tone, making it harder to feed. And then adding on to that the heart condition where she didn't have the energy, so she would get tired very quickly. And it definitely took at least an hour to feed her. These pictures are actually day before surgery. It's easy to remember. She's got the pink band on because she already went through the pre-op admission.
You know, if you think about it, your heart being the size of your fist, her fist was pretty tiny at that point, and it wasn't terribly long ago that this procedure was not perfected. You know, I still think it's a miracle that they are able to perform the type of procedure that they did on Abby. Even within days after surgery, her quality of life had improved so much.
Our biggest thing we noticed was with the feeding, going from an hour to feed to 10 minutes. That's the first bottle after surgery. I had the privilege of giving her that first bottle, and seeing her just guzzle it down was just such a good feeling. I love the way she's looking right at me.
It is quite trying to have a child with multiple diagnoses, but you know, she's a gift from God, and we love her dearly, and we're a family of faith, and we knew that whatever the outcome, it was what was meant to be.
The cover. We are thankful that a procedure exists that could fix her heart. Research is such an important aspect to continue to improve surgeries and make them better. I'm sure with funding for research, it's only going to get better and better. So we are appreciative and thankful for all of that.
It's great to know that there are associations, as the Heart Association, that do focus on research and progression in the treatment for heart disease. So we're just extremely thankful for everyone who participates in this event and gives to this cause.